Paige and Kim here to offer some happiness in this week.
Baker+Brown is starting now. Hey everybody, welcome back to Baker+Brown. We're excited to have you here with us. We know it's been an interesting week for all, and we're hoping that we can share a little bit of cheer.
Oh, absolutely. I think last week was everyone's longest week. We certainly know how to make time move slow, right? Actually, for me, it felt like it was pretty busy, but I think for people with kids at home, it was probably a very, very long week.
Oh, I know.
And so we're only a week into this, and so we're going to offer, our I guess our brand of encouragement. But I think a great place to start is actually with Kim, who has a nice list for us today. And that's one of our things we try to do each week on Baker+Brown, and I think we certainly need it this week. So Kim?
Yes, and I actually took these a little differently than I normally do. Normally we have folks submit them via email or they comment. And today we're going to share some that have been submitted. I sent out a request on Monday and had folks Facebook message me and text message me. I was actually almost overwhelmed. I've got 2 sheets, so I'll read some of them. This one came from a business. It says, the day we closed, we had a couple knock on the door and bought almost $200 worth of coffee beans and gave a $20 tip on top of that. Then, when calling to reschedule our clients, one of them wanted to just pay for the 3 weeks she couldn't come to make sure we had some cash flow.
Oh, that's beautiful.
She said it brought me to tears. Let's see. I've got a picture will pop up here. It says, our faithful family members checking on their family members while observing our strict protocols during this time. And that's from our assisted living facilities here, Morningside. And so it's a resident actually
visiting at
the window.
Oh, that's sweet.
Local Girl Scout troop donating cookies to our staff to say thank you. Girl Scouts, if you're listening, I like Samoas. Do you have a favorite Girl Scout cookie?
I guess probably the trefoils.
Oh, those are good.
Yeah.
Let's see. One of my staff members blessing a senior in need by buying their medications and dropping them off. And then I thought this was really nice. This is another business. Most people have been very generous in tipping on to-go orders. They actually mentioned some of these. Said, sweet Joey Sword with Allstate tipped me $20 cash on an $8 tab. Him and Patrick Johnson, who is with Johnson Family Agency, have been really awesome this last week about posting to local places. And on the other side, there was an elderly lady at Food Lion yesterday who could not afford what she had in her buggy and was going to put stuff back. And Paul told her she will not do such thing and paid for all of her items. That was really sweet.
Well, that was nice. That was nice. I mean, I think these are all good reminders that for those of us who are fortunate and able to continue to work, there are a lot of people in our community that cannot work at this point because their employment has been closed down or limited by the various orders. And we'll mention those in just a minute. But if you are working and you're able, it's very meaningful to help those in need right now, and to remember those too in our community that absolutely cannot get out because their health is at peril if they do. Give us some more.
Okay, there's a few more. I know. I just want to keep reading them. Keep sending them too. If you have some of these, send them to us. We've got an email set up specifically for the show, Baker+Brown at GallatinTN.org. You can always drop them in the comments or send one of us a Facebook or a text message if you know us.
Yeah, and they're great idea generators too. So.
This one says, I was at Kroger in Gallatin this morning and asked a young employee if they had any baby wipes. The baby aisle was completely empty. We're hearing a lot of that. She said she didn't think so. I went through the checkout with my groceries and I was finally out the door in the parking lot when she followed me out and asked if I was the woman needing baby wipes. She found a box. She told me she had a 3-month-old at home and could relate. Made my day. She was so sweet. Makes me want to cry. That's really sweet. Someone paid for my breakfast in Hardee's drive-thru this morning, so I just passed on the left. I guess they paid it forward and paid for somebody behind them. This one says, I've had multiple clients support my small business by prepaying for their hair appointments. It has been so refreshing and heartwarming to see the community support during this time. Let's see, had a customer call in and pay for products not needed until January 2021. So they went ahead and just made an order and said, we know you're struggling. We'll do that. And then we got word today that Buffalo Wild Wings was taking 10 cases of wings to feed the employees at Sumner Regional Medical Center.
So and I think we talked about in an earlier Facebook Live thing that we did that somebody had ordered from Epic a bunch of meals to be delivered to the hospital. So there's all kinds of ways that people are thinking of to show love to their neighbors. And so certainly would encourage you to do that. Be creative, share your unique ideas. Really some great things out there. I want to mention too that there's actually a Facebook, it's a group or a page that's been created.
It's a group. It's a closed group, and you can request to be added to it.
Request to join, and it's Gallatin Mutual Aid, and that is on Facebook. And these are people who are all willing to do things to help in our community, and you can certainly do that. Also, I think a really nice thing, and I'll mention it since it's the Chambers, is the Gallatin Pandemic Pals operation that they have going on. This is where you can sign up if you're in need or if you want to be a helper. And they're doing kinds of things like porch drop-offs, pickups of prescriptions and groceries.
But really just checking in. Some of our pals have already activated and they've called to check in on folks, and they're just really a lot of the folks that are in need, we're calling them our pals in need. They're elderly couples or individuals that need some help right now, and just checking in and making sure they're okay while they're not getting out.
Yes, because their lives have changed probably more than a lot of ours, because they probably spend each day looking for that opportunity to go out into the community and visit their friends, or go to the store, or go to get their hair done, or whatever it may be. And so some people just really appreciate the phone call. Of course, I'd remind you, you don't have to be a part of that program, to check on the people in your neighborhood that you know might be in need and that might appreciate just a phone call. Pick up some extra candy when you do go to the store, or drop them off something you think they might enjoy. And it's very meaningful in these hard times. Just small gestures. Send a card, send a note. At some point this week, I'm going to sit down and send out some notes, because I really want people to know how much we appreciate them, or that we're thinking of them, and that kind of thing.
I think I've mentioned it before, but something I have blocked on my calendar every Monday, every Monday, I have about 3 hours blocked out where I just write thank you notes. And I think right now we all have a lot more time. I would encourage you to do that. I get a really good feeling. It's kind of an interesting way. At first, it was a shift in how I started my weeks, because on Mondays you feel like you should be doing so many other things. But to start your day with gratitude is just a really great way to start your day. We have a lot of time right now, so write some notes. Get your kids to write some notes.
And gratitude, I think, is so important to happiness. If you can find something that you can be thankful for, then I think you can be happy. And I think that so many people have gotten off track because they don't understand how fortunate they are. One of the things that I think will be brought to light in this crisis that we're all in is how great our lives truly were before all this happened, and we will appreciate it more when we move forward. So I do want to talk about the orders that are out there, because they do affect our community and our businesses. On Sunday of this week, Governor Bill Lee issued orders, and then on Monday, County Mayor Anthony Holt, Sumner County Mayor Anthony Holt, also issued orders. And both of those orders are online. You can look at them. You can see if they actually impact you or your business. A lot of people are calling me. I know they're calling you for advice or interpretation. We want to help, and some of the things are really clear cut, and we can offer very good guidance. But particularly my office is really overrun with phone calls and emails right now. And so I would advise you to contact the county for specific questions related to their order, or consult with your legal counsel. But I think you can read that and interpret most of it for yourself. But those orders are online. They're on the county's website and the state's website. A lot of people have asked me. We actually did a Facebook Live over the weekend. I said, I'm working on orders. We executed one order. In case you don't know, we executed one order that gave Gallatin Public Utilities customers assurance that their utilities would not be disconnected, and that their late fees would be waived. And then this was not an order, but also I did communicate that Gallatin Department of Electricity is waiving convenience fees and is also not doing disconnects during this time. Now, in both of those instances, you are still going to be responsible for paying your bills, because they can't operate without people paying their bills. In the case of the Department of Electricity, they do not have, at this time, the flexibility to waive late fees, because they are a TVA power provider, and they have to be given that authority by both TVA and their board. So that is not in place, but it is for GPU. Our second order or my second order was actually closing all of the city buildings, and we did that, so they're all closed to the public. Kim is actually in a city building right now, but she will be leaving immediately after. We are allowing people in for meetings, but they are being screened, and we are offering alternatives so people can participate electronically. The third order that was written and planned this weekend was a further guidance for preventing the spread of COVID-19 in the city of Gallatin. However, the county issued orders. I don't think that issuing additional orders would have helped anybody. It had some different things in it and offered some different requests of our community, but I think trying to do orders on top of orders on top of orders is going to become very cumbersome and confusing for people. So that's where we kind of are with the current orders. One thing I'll offer, and I said this over the weekend, whatever situation you're in, whether you're working or you're not working, please realize that the people who are not working, many of them wish that they could be working, and those who are working wish they could not be working in some instances. So no one is in a perfect place right now. We all have challenges at this very moment, and we certainly are going to have more in the future, but we are going to get through this, and we are going to be better on the other side.
I think that's sound advice. I know we even kind of had, I wouldn't say an argument, but at my house, like a little bit of a disagreement. I was like, well, we both have to work and we both got to do stuff. So we've kind of divided and conquering like childcare at my house, because it's not like a break where we're just home and getting to enjoy our time. It's who's going to work here and how are we going to do this? So I think, within your home, within your organizations, just be mindful of that and be kind to everybody, because everybody's trying their hardest right now.
They absolutely are. And I say this often, but I'll say it again, extend grace to each other. And realize that in this time, this unprecedented time that we're all experiencing, that by and large, most people are doing the very best that they can, and appreciate that and give them some room to make errors. I know that the last couple of days I have not felt like I had my communication skills as they should be, because I've just been all over the place with things. Yeah. But as a reminder of how important it is that we do what we're supposed to be doing, we actually have you should mention that first.
Yeah, before we flip to that, I want to mention this. I just got this over. I better not do that.
I'll hold it.
You hold it.
Well, no,
don't hold it.
Yeah, you're right.
Ooh. Okay, I'll hold it up
Here,
like this.
Give me the paper.
Well, no, I'll just hold
it.
It says Give Blood, Save Lives. And so Sumner Regional, we'll pop this on the screen too. Sumner Regional is launching a blood drive. There is an immediate need from the Red Cross to give blood. And so this has different times, kicking off on March 30th. So they'll be having weekly blood drives. And some other facilities are doing this as well, but this will be here in Gallatin at Sumner Regional Medical Center. And we'll share that information.
And if you are at all able, we would certainly encourage you to give blood, because there are people that need it. Other needs exist in addition to our COVID-19 patients, and blood is very, very important, as you know. So not only is demand up, but supply is down. So please donate if you possibly can.
And I know that somebody asked the other day when we mentioned that these were coming, somebody asked the question, well, what about someone who has COVID-19? How will you test? I feel certain that the hospital is taking all of the proper measures to make sure that those donating blood are not positive and not infected, just as they would anytime anybody else gives blood.
I think they can irradiate blood to kill certain things, but not a medical professional. I'm going to quit going down that road. But speaking of medical professionals, we did want to bring you a very important message from our Chief Medical Officer at Sumner Regional Medical Center. Dr. Jeffrey Lifforth has a few words about why we're doing what we're doing and why it is so very important.
Good morning, everybody. My name is Dr. Jeff Lifford. I'm the Chief Medical Officer at Sumner Regional Medical Center, and I'm grateful to have a few minutes to talk to you about COVID-19 and the things that we can be doing as a community. As everybody knows, this is a serious health concern, and one of the big challenges we have is this is spreading quickly. It is a virus that no one has had before, and so there's no immunity to it. And although it's very likely over the coming months and year, a lot of us will get this, one of the biggest goals we have as a healthcare facility and as a community is to try to slow the spread as much as possible so that our healthcare systems aren't overwhelmed and that we have beds and staff to take care of people. So the first thing I would like you to do is to please understand how serious this is. Even though the majority of people that get it have mild to moderate symptoms, the ones that do get seriously ill need hospital beds and critical care sometimes. And so please understand that this is a serious issue and that we need to act right now. So what you need to be doing is, with the people that you're involved with at your church, at your business, at your community, is really stress to them the importance of social distancing. This means people really need to stay home unless absolutely necessary that they go out. If you go out, you need to stay at least 6 feet away from other people, cover your mouth when you cough, and wash your hands often. Also, if you have someone that you know has gotten it, or someone that might have it, someone that has a new cough or congestion, please encourage them to stay home, and not just stay home, but they should really, even in their house, be self-isolating. And by that, they should be in their bedroom, away from other members of the house, washing their hands often, and doing everything they can to minimize the spread of germs. Finally, the question I'm getting from a lot of people is, when do I or a friend or family member need to go to the hospital? Right now, there really is not an effective treatment for COVID-19. What we do is the people that have severe symptoms, they get short of breath, and we place them on oxygen or more aggressive things if they need it. So coming in right now to getting tested if you have a cough is not helpful. In fact, if you don't have it, you might get exposed by coming in and being tested. So if you think you have it, the most important thing is to self-isolate at home and avoid spreading it to someone else. And then come in if you get to the point that you can't breathe very well. So that's really the line we need to come in and be tested. Please be safe. Really share this message with everybody that right now, over the next week or two, we have a chance in Sumner County to stay home and avoid interacting with other people, and that really will save lives. Thank you.
That's excellent information from Dr. Lifford, and we are so appreciative of Sumner Regional providing us with that. We're also appreciative, of course, in general, of Sumner Regional and all of the healthcare providers in our community. They're working really hard during this time and are in a very difficult situation. Right now, we have another important person from our healthcare community with us. This is Mr. Hal Hendricks. He's the County Director of the Sumner County Health Department. He's also a classmate of mine from way, way back. But glad to get to spend time with you. Hate that it's under these circumstances. Can you tell us a little bit about what you're observing in our community right now?
Well, we have moved quite up the ladder quite quickly, and I'm a little upset, nervous about things, but we're coming together. The community has responded. We've got some new objectives in place. We're seeing patients. We're getting quite a few phone calls. And again, I would tell people, if they feel ill at all, contact their provider. Stay at home. Contact, if they can't get in touch with their provider, call 615-206-1100, the health department. My staff is there. They'll be happy to answer any of your questions and concerns. And we're just going to move forward with this.
And I know you concur with Dr. Lifford on the social
Yes.
distancing. I want to ask you this, and Kim, you've probably been experiencing this too, but some of the phone calls that we keep getting are people that work in various sectors that think that their place of employment is not doing all that they should. Is it good to refer them to you, or how can we best handle that?
They can call our office. However, a lot of this is just common sense. Keeping your distance, cleaning services. I know that many businesses are, after every customer, they're wiping down that counter, that cash register, their work areas, and they should be limiting the number of individuals coming in and out of their office daily.
Yeah, we were talking about the county orders that we are now currently under. I'd actually prepared orders to release the same day that those were released, but did not do those because we don't need any more confusion. But one of the things that we were considering for our orders was to limit the occupancy on some of these businesses that did allow the public in, like grocery stores, because some of the grocery stores were, to me, too crowded to be safe. And so I was going to suggest that they limit occupancy so that social distancing could be observed at any point within in the store, but that didn't happen. But I think it's still certainly good advice, so I appreciate
Yes.
you bringing that up.
Yeah, and that's the main thing. Washing all the surfaces, washing your hands frequently, 20 minutes, 20 seconds with soap and water. I laughed the other day. I said the first time I sang the alphabet while I washed my hands.
I was just about to ask which
45 years.
Which song do you sing when you wash your hands?
So that's a new habit to get into and hopefully stick with us for years to come. So.
What about you? What do you sing?
I've been singing the alphabet. That's and I've been singing it with my daughter, something we can sing together. So I think she's a little confused because I'm over there holding her hands and scrubbing them extra good, which these are all things we probably should have been doing anyway. So.
Correct, yeah.
Do you have any other advice that you would offer to individuals? I'd like you to offer something just to encourage people because, I mean, we're only a week into this really, and it is already tedious.
Please be mindful, be patient. This is not something that's going to end tomorrow. We're going to keep an eye on these numbers, and we've got a number of great staff in the health department, emergency management, our first responders across the county, across the city are working diligently, and this could be with us a few weeks, but with your help, we can decrease these numbers and stop this community spread, and we can end this faster. So we appreciate all the help you could do.
And that's why we're all doing what we're doing. What about testing?
We're testing every day. 615-206-1100 is the health department number. Feel free to call. My staff will answer. We'll triage you, see if you're high risk, low risk. We'll call you to discuss to come in and get tested if they feel that you're a candidate. So.
Right now, can you walk into the health department, or do you have certain restrictions to limit visitors to the health department?
We are very limited. We have a triage area only where we're sending COVID-19 patients. Actually, we're doing curbside service. So that's the first time I believe in many years. The old public health used to be the nurse and the buggy would come out to the country
shots.
and give you your shots in the kitchen of your house. And I said, funny how times have come back. We're not quite riding our buggies to your house, but we're doing curbside service and taking care of individuals that don't have to get out of their car.
I read somewhere that everything that was once old is new again. So.
Well, but think how fortunate we are to have the technology that we do. I had the conversation, what if this had been 10 years ago? And we weren't as advanced as we were technologically for communication purposes. Honestly, I think there'd be some benefits to be that, but then I think the advantages probably far outweigh that, and so we have to be mindful of that. Is there anything else, Hal, that you want to share from the health department's perspective that we haven't touched upon?
No, everyone just remain calm, and if they feel bad at all, if we're getting into allergy season, and that's in the next 3 to 4 weeks where these trees starting to bloom and people are getting an itchy throat, and if they're feeling bad at all, please be wary and contact their provider or contact the health department so we can make sure hopefully it's just allergies.
Right, and until you determine that, stay away from people. Well, it's about time for us to wrap up today. I did bring a book. Have you read this one, Kim?
I've skimmed that one. My husband's read it. It's on our shelf.
Hal, have you read it?
I've not seen that.
This is Old Sumner County. It's a history of Sumner County, Tennessee, and this is another book from our beloved Walter Durham. I've mentioned him before. He was the state historian, the Sumner County historian. He passed away a few years ago, but he left us with many great documented histories of Sumner County, Gallatin, and Tennessee. So this is the history of Sumner County from 1805 to 1861. So it's the very early days of our county, and it's really interesting when you look at when you learn about what the centers of the community were back in those days. They're not the same ones they are now. So I would encourage you to get this book. It is long. It is. It's not the easiest book to read, but there are great references in here. And one thing I'll tell you about all of Walter Durham's books that I've seen is they have great indexes in the back. So you can actually look it up, and I'm going to do this just for kicks. I'm going to look up Brown in the back of this book and see who's listed. R.T., Reuben, Richard, William,
And it tells you the pages they're mentioned.
Pollard, Neil, Mary, Joseph, John, Greenberry, yeah, probably one of my relatives, George, GL, DG, Eliza, Eliza and Dance were my grandparents, and so they're all documented in this book. And so it's fun to, even if you don't want to take it page by page, use that index and look up things you may be interested in. So are they still have any of these available that you've seen?
I think the museum does have some. I can't confirm that, but we can drop in the comments below if we find out. Normally you can get it at the library, but not right now. But you might reach out on social media and see if a friend has one that they could leave on their porch for you to pick up and read.
Mm-hmm. And I hope this time makes us appreciate our libraries. I keep looking for silver linings. Have you found any silver linings in this?
My staff were talking today, quite a few of them, they were trading board games, new board games. Have y'all played this? Have y'all played that? So that was kind of neat. They said the families are getting to stay together, the kids, and they said, usually they're at the ballpark this time of year, but they said, no, we're at home, and one with her boys, and they said, we're having fun around the kitchen table, my husband, wife, and the two boys, and you don't see that very often
Right.
Not
anymore.
anymore.
What's yours?
Let's see. There's a lot. I guess we've just. I've had a little bit of a slowdown. I've had more time to be at home. We recently moved into a new house. We got a lot of things hung over the weekend on the walls and
I'm jealous.
what? Hanging things on the
No, I
wall.
want to be home. I want to be home.
Well, it hasn't been. I
know, you've
we've
been on
been
the phone
busy,
a lot,
but
so.
I've been in my house and I've gotten to do stuff in my pajamas.
And I've got to come to Kim's house to do some
Yeah.
Facebook Live updates. I think my silver lining, I've actually had several. Every time I get one, I'm like, aha, another silver lining. But the one that's coming to mind right now is nobody has yelled at me about traffic in this community in the last week. So I said that's a good thing. So we're going to say goodbye, friends. We thank you for all that you're doing in the community. We thank you how you're supporting each other. You're following what your guideline. You're doing what the guidelines say you should be doing, and you're loving on your neighbors and helping to take care of them. So we appreciate that. Kim always has great parting words.
Yeah, just keep being calm and kind, and we'll see you next week on Baker and Brown.
Absolutely. Thank you for joining us. Y'all have a great day.